Hello and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, good afternoon, or good evening to those who are watching us or listening to us today.
The topics today are Zika virus and long-term consequences for the immune system. Dengue infection is linked to increased risk for COVID disease. COVID infection can trigger changes to the immune system that may underlie the persistent symptoms that may happen after COVID. We address the question if SARS-CoV-2 infection or vaccination may cause birth defects. We cover the burden of disease of RSV in children under and over 2 years of age. We bring you the characteristics of better vaccines for a next pandemic. And finally, I will bring to you a definition of long COVID. But we start with Zika and we start with Melvin.
Yes. So I chose this piece because I think that we have not talked about Zika in a long time. And this is good because this is really insightful. Only 5% of infants exposed to Zika in utero develop physical or neurological disabilities associated with congenital Zika syndrome. And almost all children exposed to Zika in the womb may experience changes to the immune system. And this study is based on a small cohort of Zika-exposed children followed up by researchers from the Cleveland Clinic in the US. So 42 Zika-exposed infants were assessed at birth, and 20 children exposed to Zika during pregnancy were assessed at the age of 2 years in Brazil. They provided blood samples and were compared to healthy controls. And the researchers found high elevated levels of inflammation even after 2 years after infection with Zika virus. So I think it's interesting to note that with the Zika exposed children, 2 years after they've been exposed to the Zika virus, their levels of inflammation in their body is still quite high.
We continue to learn about this interesting disease, and I think you have more information about it, right? You have a summary from what we have known already.
Yes, so this is just a review, right? Because we haven't talked about Zika in a long time. It's a mosquito-borne virus first identified in Uganda in 1947 in a rhesus macaque monkey, followed by evidence of infection and disease in humans in other African countries in the 1950s. It became really top issue in the news in February 2016 when WHO declared a Zika-related microcephaly public health emergency of international concern. And they talked about the causal link between the Zika virus and congenital malformations in November of that same year. And although cases of Zika virus disease declined from 2017 onwards globally, transmission of the virus persists at low levels in several countries in Latin America and other endemic regions. And this is just showing us what we mean when we say microcephaly. So the baby on the left, that is supposed to be the normal size of the head of the baby, but those who have been exposed to Zika have microcephaly or a significantly smaller head.
Yeah. Very interesting. And thanks for the summary of what we have already learned from the past. Melvin, your next topic is dengue and increased risk of COVID. What's the story here?
Yes, so in open forum infectious diseases, researchers from the National Center for Infectious Diseases in Singapore, Duke NUS Medical School, National University of Singapore, and the Singapore General Hospital linked dengue infection to a slightly increased risk of subsequent COVID infection and a significantly higher risk of severe COVID illness and hospitalization. So for the study, investigators really looked at records of a registry to evaluate COVID-19 infections and outcomes amongst 3.4 million adults from July 2021 to October 2022, when the waves of SARS-CoV-2 Delta and Omicron variants followed a dengue outbreak in Singapore. And it's interesting to note that in total, 13,434 dengue infections were documented, and nearly all were mild and didn't require hospitalization. During the same period, over a million subsequent COVID-19 cases were recorded, of which 9.2% occurred during the Delta wave, and most of them occurred during the Omicron wave. And the average time for dengue to COVID infection was 94 days. The dengue infection was tied to a modest elevated risk of subsequent COVID infection. So the adjusted hazard ratio was 1.13, so slight elevation, right? But a more than triple risk of severe COVID-19. So the adjusted hazard ratio is 3.39, and hospitalization was 3.25 across vaccination subgroups. So it really showed that there is this increased risk, right, of severe COVID and hospitalization after a dengue infection. And I think we're not trying to say that one is causing the other, but this could be a start of that research to show if indeed one is really making the other worse, right?
They are quite different viruses. One is the coronavirus, and dengue is a flavivirus that is mosquito-borne, in contrast to the tick-borne. So they're both. It's flavivirus versus coronavirus. So maybe there is a change again in the immune system that has to do with it.
That's right.
And did they look at the time from corona infection to dengue? That may also influence the finding.
Yeah, so it's like 3 months.
3 months, okay. Interesting. Now, as a next topic, COVID infection that will trigger changes in the immune system, and that may underlie long COVID, persistent symptoms, right?
Yes. So COVID-19 infection, as we know, even mild cases can cause substantial long-term changes in the immune system that may be implicated in the long COVID story, right? And this is a study by researchers from the Medical University of Vienna, and it was published in the journal Allergy. They assessed the numbers and composition of cellular and humoral immune parameters in blood, so the immune cells, cytokines, and growth factors, in over 100 COVID-19 survivors 10 months after infection from May to August 2020, a period dominated by the wild-type virus. So this was before all these newer variants came. And they also measured levels of antibodies against SARS-CoV-2 spike protein, the receptor binding domain, and nucleocapsid protein. And the results were compared with those of 98 matched uninfected people. All participants were unvaccinated because COVID-19 vaccines weren't available at that time. And it's really interesting to see that in the study, they found out that cytokines and growth factors in the blood were characteristic of remnants of acute inflammation at 10 weeks post-infection. And a comparison with the patient samples collected 10 months after showed a significant reduction in immune cells, a drop in SARS-CoV-2 antibodies, and a change in growth factor proteins. So this could give us an idea of what's happening in the immune system and why some of those who were infected with COVID still have persistent symptoms many months after initial infection.
Yeah, we discussed the various theories for long COVID in the past. And again, this is now an immune type explanation why we see long COVID or symptoms after COVID infection. Actually, I will cover that in a minute or later on. I have a short piece on SARS coronavirus infection or vaccination as cause of birth defects. And this is a very nice prospective Nordic registry-based study from Sweden, Denmark, Norway. And they looked at more than 340,000 live-born singleton infants from 3 countries, and where pregnancy started roughly between March 2020 and February 2022. And then they looked at congenital anomalies at birth, and their risk assessment was done by logistic regression, and there were all types of adjustments. In the end, they found that 17,704 infants, had major congenital anomalies, and that is roughly 5.2%. And this is exactly the number, or roughly the number, that I would have expected I think if you have a well-trained pediatrician, he may find 4% of congenital anomalies. If you take a very well-trained pediatrician with an ultrasound machine, he will find 6-7% of anomalies. So this 5.2% from a registry is an excellent number. I doubt if they missed many cases. So this is really high quality study and high quality data. Now the finding on top you see now for infection, and if you go to the far right side, it is fully adjusted odds ratios. And for all the numbers you see here on the far right column, it is always between below 1 and a little bit above 1. And this means the odds ratio always crosses the 1, and that means there's no significant finding. So infection with SARS coronavirus doesn't result in any congenital anomaly. How about vaccination? Same thing. They look at the different anomalies here on the left side as defined by different bodies or by the Eurocat body in the end. And again, you see that all the numbers here, the odds rate, the 95% confidence interval crosses the 1, and there is no significant finding here. And so in the end, neither the infection nor the vaccine do cause any congenital anomalies from all we know. I think this is a good finding, right? That is, we like that.
Yes.
My first topic is SARS coronavirus infection or vaccination as cause of congenital anomalies. And this is a nice study from the Nordic countries, from the Nordic registry based information system, Sweden, Denmark, and Norway. And they prospectively looked at more than 340,000 live-born single-cell infants from these countries in the time from March 2020 to February 2022. The main outcomes were congenital anomalies as defined by Eurocat, and they looked at then the risk factors. Risk assessment was done by logistic regression, and there were all types of adjustment. In the end, they found 17,704 children who had major congenital anomalies, and that is 5%. And that is roughly the number in the middle of what one would expect. If a pediatrician is examining a newborn, he would find 4% of congenital anomalies. If he has an ultrasound machine and is well trained, he may find 7 or 8%. Now the 5% is roughly in the middle. So this looks to me like an excellent high quality study. And I think this is very valid data. Let's look at the outcome, and we start with infections. And what you see here in the right column, you see the fully adjusted odds ratio, which always, where the 95% confidence interval always crosses the 1. And here are the point estimates. And since the 95% confidence interval crosses the 1, there is no significant finding. So that means infection with SARS coronavirus 2 doesn't cause any congenital anomalies. How about vaccination? What you see here on the right side, again, fully adjusted odds ratio, the 95% confidence interval always crosses the 1, so there is no significant finding. And the conclusion is that COVID-19 infection and vaccination during the first trimester of pregnancy are not associated with a risk for congenital anomalies. Melvin, any views on that one?
Well, I think this is good news, not just for vaccination, but also for COVID infection as well, right? I mean, the first 3 months of pregnancy, the first trimester, are the most important ones, really, in terms of the growth of the organs and of the fetus. So I think this is good news.
I think it's quite interesting because we do know that the SARS coronavirus 2 does spread throughout the body. You see symptoms from many organ systems throughout the body. So my concern would have been that there is something like congenital anomalies, but looking at this data, there isn't, right? I think this is very interesting and difficult to explain, but a reassuring outcome. I then have RSV in children under 2 years and over 2 years of age. And the background is that we don't know much about RSV epidemiology in those over 2 years. And this is basically a case series from a Myers Children's Hospital from October 2019 to March 2023 that is 3 seasons with RSV, and they looked at children 28 days to 18 years with RSV infection. They identified in the 3 years 584 infants and young children with RSV. And basically, the main finding is older children had higher comorbidity, 41% versus 9%, and they were more frequently premature, 26 versus 14%, than those under 2 years. And I can show you the data in more detail, but it doesn't make much of a difference. In the end, the learning from this is that it is very young. In the first year of life, you get severe disease, which is bronchiolitis mostly, and that is a result of the small airways. If you get older, your airways are larger, and this is why the severity of disease gone down. And you only come down with RSV hospitalization or severe disease if you have a comorbidity or if there's prematurity. You can download the data from our PDF that we will provide, but again, the conclusions are listed here. Melvin, any additions here to RSV?
Well, I think this is good information. We are getting a lot of information now because of the new RSV vaccines that came in the last year or so, and so this is giving us more context to the RSV problem globally. Yeah.
I think largely adult physicians in internal medicine, they didn't look at RSV in the past. And we don't have much information on adult RSV. And likely this is one of the most common infectious diseases of mankind. And I would not be surprised if we see very similar morbidity data from adults. But let's see what that may, what we will find in the future. Very interesting New England Journal of Medicine paper just recently listed criteria how to have better vaccines for the next pandemic. They want to have a correlate of protection. Yes, it would be wonderful because then you don't need to do many studies, right? If you have a correlate of protection in immunogenicity and the safety study would be fine. Broader protection, right? We want to cover all variants that come up. We want to have more than 6 months of protection. Immunity is the wrong word. Immunity, I don't care about. We want to have protection. Prevention of infection, sterilizing immunity, that would be wonderful. Alternative routes of administration, we have been looking for this over decades, ever since I'm in the vaccine business 30 years ago. That's what we want, right? We want to make sure that you have an oral vaccine, right? Why not? It's just difficult. Sustainable manufacturing approaches, it has to be simple, it has to be high quality, and it has to be large volumes. Good safety profile. You have to be able to have your factory that can produce anything, not just one vaccine, but many. And you certainly need trust in the vaccine. Melvin, maybe you have more items that you would want to list here.
Well, not really related to vaccination, but a lot of our lessons from the past pandemic is really about communication for science, right? And I think, I mean, that's why we're doing this, right? So it's not included here because it's not really related to the vaccine or the virus or surveillance, but it's very important because communicating all these things that are listed here, right? Communicating correlates of protection, broader protection, immunity, all these things, that's what's important for the public.
Yeah, very important point, right? Very good. And then I have finally a definition of long COVID, and that is from the National Academies of Sciences, Engineering, and Medicine in the United States. To make a long story short, I go over briefly over the cartoon here, but the short story, my interpretation is this is not a definition. This is just a very sensitive outline of what can be COVID. And in the end, what it says is you should have been infected with the SARS coronavirus. There may be asymptomatic cases. So even if you don't remember that you have been infected, you still may come down with long COVID. The common symptoms are listed here. There may be diagnosable conditions that may pre-exist or that may come along with COVID, right? You can have all types of findings, organ findings with long COVID, but they can also pre-exist. And then they describe important features, like long COVID can affect children and adults. It is regardless of underlying diseases, socioeconomic status, whatever. It can resolve over a period of months, or it can persist for months to years. It can be diagnosed on clinical grounds only. There is no biomarker, there is no blood test. And then it can impair affected patients' ability to work, attend school, and so on and so forth. So I think this is a very nice summary of how COVID can look like, but in a strict sense, this is not a definition, right? It is not, if you have 1, 2, 3, 4, 5, then you have COVID. I was quite excited this morning when I opened the paper and I was expecting just this, but then I found the nice cartoon and I think it's a very good summary, and maybe that is even something for a handout that you can give to your long COVID patients. Melvin, any views?
Yes, so I think what the National Academy of Science and Medicine and Engineering, right? Engineering and medicine, they just tried to put in together a comprehensive summary of what we know so far. It's very difficult to really pinpoint what is the definition, because as we've mentioned in the past in our other COVID specials, the experts have mentioned that it's really a lump of all the different organs in the body, and we don't really know if it's just COVID or their chronic medical conditions or some other virus or some other pathogens that's causing it. And so it's very difficult to really pinpoint what is long COVID, right? Yeah. But I think to have a very comprehensive list like this is good to just see what can be included.
Yeah, I think it is a very sensitive approach. It is less specific, right? If you have one of these findings, you still have you still could have early Alzheimer or I don't know what, right? So yeah. I think it is a very interesting approach, but I think this is a nice thing for handouts. Read the paper, highly recommended. There's a lot of other information. They also compare different definitions of COVID, which may be very helpful, particularly if you do COVID or long COVID research. And with this, I can summarize Zika virus and long-term consequences for the immune system, downregulation of the immune system. Dengue may be linked to increased risk for COVID, and that again may be due to the immune responses. COVID infection can trigger changes to the immune system that may underlie the persistent symptoms. SARS-CoV-2 infection and vaccination, there is no association with birth defects. The burden of RSV in children over 2 years and under 2 years was described in one paper, and again, over 2 years, what you find more is prematurity and underlying diseases. Then we looked into criteria to improve vaccines for an next pandemic. And finally, we discussed a definition for long COVID by the NASM. Very good. Finally, Melvin, you have a cartoon in the end.
Yes. So I chose this because I think this is interesting. It shows that amateurs often view challenges as obstacles that are very difficult to solve or to face. They may feel overwhelmed and discouraged when faced with difficulties like this. But professionals, on the other hand, they look at challenges as opportunities to learn and grow. They understand that obstacles are natural part of learning, of the learning process, and are really essential for personal and professional development. So I think it's a growth mindset, right? It's how we look at obstacles and challenges in life.
Yeah. So basically, accept that there is a problem, but try to learn something from the problem. That is the approach. I like it very much. Thank you, Melvin.
Yes, and because we will always have problems, right? So there's always something.
Yeah. And with this, goodbye for this time. See you again next week.
Thank you, everyone. Stay safe.